That feeling hits you right as the sun goes down. Your legs feel heavy, like they belong to someone else. The dull ache settles deep in your calves. Your feet stay cold no matter how many blankets you pile on. And those ankles start to swell, pressing against your socks until the marks stay there for hours. If you're over 70, you probably recognize this exact pattern. You may have been told it's just part of getting older. I'm here to tell you it doesn't have to stay that way. A remarkably simple movement you can do from your chair right now can push fresh blood through those tired veins and start turning the situation around. A study of 307 adults measured exactly this. 5 minutes of one targeted ankle movement raised blood flow velocity in the popliteal vein from roughly 13 centimeters per second at rest to more than 15 centimeters per second. That is not a vague feeling. That is a measurable surge that carries oxygen and nutrients back into the tissues that have been starving for it. I'm Dr. Hana Sasaki. For the past 15 years, I have cared for older adults in surgical and vascular clinics across California. Every week, I see people who believe their independence is slipping away because their legs simply won't cooperate. What surprises most of them is how quickly the body responds when we give the calf muscles the right mechanical signal. The slowdown in leg circulation after 70 is not mysterious. Gravity never stops pulling fluid downward. When we move less, the second heart in our lower legs falls silent. That second heart is the calf muscle pump, and it is the key to everything we are about to discuss. Let me explain exactly how this system works inside your body. Your heart pushes bright red blood down through the arteries all the way to your toes. That blood delivers oxygen and picks up waste. Now, the dark, deoxygenated blood must fight gravity to climb back up to your heart and lungs. It does not do this on its own. Inside the deep compartments of your calf sit large veins surrounded by powerful muscles. Every time those muscles tighten, they squeeze the veins like a hand squeezing a tube of toothpaste. One-way valves inside the veins snap shut behind the column of blood so it cannot fall back down. This is the calf muscle pump, and it is every bit as important as the heart itself for returning blood from the legs. When you were younger, you walked more without thinking about it. Each step triggered dozens of these pumping cycles. After 70, many of us sit for long stretches reading, watching television, or riding in cars. The muscles stay quiet. Blood pools. Valves that once moved effortlessly begin to stretch. Fluid leaks into surrounding tissue. The result is swelling, heaviness, cold feet, and night cramps that steal your sleep. I remember a patient named Margaret who came to me after her 80th birthday. She had always been the one organizing neighborhood walks and tending her prize roses. Within 6 months, she had stopped both. Her legs felt like wet sand. She told me she could barely make it to the mailbox without stopping to rest. The skin around her ankles had taken on a rusty brown color, a classic sign that red blood cells had leaked out and broken down. Margaret's story is common. The good news is that the same mechanism that caused the problem can be used to fix it. The calf muscle pump does not require marathon training. It responds to deliberate, repeated contractions even while you sit. Before we talk about the solution, let's make sure you recognize the signals your body is sending. Swelling that worsens by evening is the most obvious. You notice your shoes grow tighter as the day goes on. Socks leave deep grooves that take minutes to fade. This is not ordinary fluid retention. It is plasma and red cells that the veins have failed to return upward. Nighttime leg cramps are another urgent message. When circulation slows, muscle cells run low on oxygen, lactic acid builds, the muscle contracts violently to demand more blood. Many patients describe waking up gasping, grabbing their calf, and hobbling around the bedroom at 3 in the morning. The pain can be so sharp it leaves the muscle sore for days. Then there is the constant heaviness. Patients tell me their legs feel like they weigh 20 pounds more than they should. One retired mail carrier named Robert said it felt as though someone had strapped lead weights around his ankle. He had always taken pride in walking his dog 3 miles every morning. Within a year, he was down to 1 slow block before the fatigue forced him to turn back. Skin changes tell an even clearer story. Brown staining around the ankles, known as hemosiderin deposits, shows that blood has been sitting too long. Itchy, dry skin that cracks easily appears because tissues are not getting steady nourishment. Small cuts on the shins take weeks instead of days to heal. In advanced cases, you may see clusters of spider veins or ropey varicose veins that ache by mid-afternoon. These symptoms are not minor annoyances. They are warnings that your risk of deeper problems is rising. Poor venous return increases the chance of superficial blood clots, skin ulcers, and infections that can become serious in older adults. The earlier you act, the more independence you protect. The single most effective action I prescribe in my practice is something called ankle pumps. The name sounds almost too simple to be powerful. yet the physiology is elegant. When you point your toes down and then pull them back up toward your shin, you create a full cycle of contraction and relaxation in the calf muscles. Each cycle squeezes the deep veins, opens the valves in the right direction, and pushes blood upward. The valves close behind it, preventing backflow. You are literally operating the second heart in your legs. You can do ankle pumps anywhere, sit in your living room chair, lie in bed before sleep, even ride in the passenger seat on a long drive. The movement itself takes almost no energy and puts zero stress on your knees or hips. Here is exactly how to perform them. Plant your feet flat on the floor if you are sitting. If you are in bed, keep your legs relaxed. Slowly press your toes away from you as though gently pushing a gas pedal. You will feel a mild stretch across the top of your foot. Hold for 1 full second. Then smoothly pull your toes back toward your shin. You should feel the calf muscles tighten under your hand if you place it there. Hold for 1 second at the top, then repeat. The rhythm is point, flex, point, flex. 15 to 20 repetitions make 1 set. 2 to 3 sets spread across your day deliver the best results. The beauty, according to the research, is that speed does not matter. Whether you move slowly or at a moderate pace, the improvement in venous blood flow is statistically the same. This removes the pressure many older adults feel to perform exercises vigorously. Gentle, controlled motion works just as well. I often tell patients to link the exercise to things they already do. Do 1 set during every television commercial break. Perform another set while you read the newspaper. Set a quiet timer on your phone to remind you once an hour during long sitting periods. On airplane flights, I advise patients to do ankle pumps every 30 minutes while seated. The difference in how their legs feel upon landing is dramatic. The study I mentioned earlier tracked 307 adults ranging from 65 to 89. Researchers used ultrasound to watch blood flow in real time. After only 5 minutes of ankle pumps, the velocity in the popliteal vein rose consistently. More importantly, the effect lasted for nearly 30 minutes afterward. That means 1 set creates a window of improved circulation that carries you through the next chapter of your day. I have watched this translate into real life for hundreds of patients. Take Mr. Alvarez, a 76-year-old retired mechanic who developed swelling so severe he could no longer fit into his work boots. After 6 weeks of ankle pumps performed 3 times daily, the swelling around his ankles dropped by more than 2 centimeters. He told me he could finally kneel in his garden again without his legs going numb. His grandchildren noticed he was willing to play catch with them once more. Then there was Mrs. Chen, 81, who had suffered nightly calf cramps for 3 years. She started doing ankle pumps while watching her evening news program. Within 10 days, the cramps became less frequent. By the end of the first month, they had almost disappeared. She regained the ability to sleep through the night, which improved her mood, her appetite, and her overall energy. These stories are not exceptions. They reflect what happens when we stop accepting poor circulation as inevitable and instead work directly with the body's own mechanisms. As you grow comfortable with a basic ankle pump, you can add natural progressions. Once your balance feels steady, try standing calf raises. Hold onto a sturdy chair, rise slowly onto the balls of your feet, then lower with control. This adds body weight as resistance and builds even stronger pumping power. Start with just 5 repetitions and work upward. Some patients eventually add resistance bands around the ball of the foot for extra challenge, but the majority find that consistent ankle pumps while seated are more than enough to maintain excellent venous return. It is also wise to combine ankle pumps with a few supporting habits that amplify the effect. Stay well hydrated. When you drink enough water, blood volume stays higher and vessels function more efficiently. Elevate your legs for 10 minutes twice a day, especially in the late afternoon. This uses gravity in your favor to drain fluid that has collected. Wear loose clothing around the thighs and calves so you do not create artificial tourniquets. If your doctor has recommended compression stockings, put them on first thing in the morning before swelling begins. Nutrition plays a supporting role too. Foods rich in flavonoids such as berries, citrus, and dark leafy greens help strengthen vein walls. Consistent protein intake supports muscle maintenance so your calf pump stays strong. I often remind patients that circulation is a whole body conversation. The ankle pump is the clearest sentence in that conversation, but the supporting words matter. Many people ask me whether ankle pumps help if they already have diagnosed venous insufficiency or even a history of blood clots. The answer is yes, provided you have clearance from your own physician. In my practice, I prescribe them routinely after vein procedures, joint replacements, and during long hospitalizations, precisely because they reduce the risk of new clots forming. They are frequently used in hospital protocols for exactly this reason. There are moments when you should be more cautious. If you have an active blood clot, acute injury, or recent surgery on the foot or ankle, check with your doctor first. If you experience sudden sharp pain, warmth, or redness in one leg only, stop the exercise and seek medical attention immediately. Those can be signs of deep vein thrombosis that need urgent evaluation. Safety always comes first. One of the most rewarding parts of recommending ankle pumps is how quickly they restore a sense of control. Many older adults feel that aging is something that happens to them. When they discover they can influence blood flow with such a simple action, hope returns. They begin to see their body as an ally again instead of an enemy. I encourage you to treat these movements as quiet conversations with your circulation. While you point and flex, notice the subtle warmth that begins to spread through your feet after a few repetitions. That warmth is fresh blood arriving. It carries oxygen, it removes waste, it reduces pressure inside the veins. Over weeks and months, these small daily conversations add up to major changes in how you feel and what you can do. Think about what you could regain. Longer walks with friends, standing in the kitchen to cook a full meal without having to sit down midway, playing on the floor with grandchildren without worrying that you will not be able to stand back up, traveling comfortably on buses or planes, gardening until the sun sets instead of cutting the day short because your legs ache. These are not unrealistic dreams. They are the ordinary pleasures that consistent circulation support makes possible. Again, I have seen patients return to traveling across the country to visit family because their legs no longer swell during flights. Others have resumed ballroom dancing, something they thought was lost forever. One gentleman in his late 70s started volunteering at the local elementary school again once his nighttime cramps stopped interrupting his sleep. The common thread in every story is that they began with the same simple ankle movement we are discussing today. Let me share one more story that stays with me. Mrs. Tanaka was 74 when she first came to my clinic. Her legs had become so unreliable that she had stopped attending her weekly book club, one of the great joys of her life. She described her calves as two tired soldiers who refused to march anymore. We started with ankle pumps performed during every chapter she read at home. Within 3 weeks, she noticed the swelling had decreased enough for her to wear her favorite shoes again. By the end of 2 months, she was back at book club, walking the 3 blocks from the parking lot without stopping. She told me the greatest gift was not the physical relief, but the return of anticipation. She once again looked forward to leaving her house instead of dreading it. That shift from dread to anticipation is what I want for every person watching this. Poor leg circulation does not have to define the next chapter of your life. Your calf muscles are still there, the valves are still there, the veins are still there. All they need is the proper mechanical signal given at regular intervals. I want you to begin today, right now, while this video is still playing. Try 10 slow ankle pumps with me. Point your toes away. Feel the stretch across the top of your foot. Now pull the toes back and feel the calf tighten. Good. Do that 9 more times. Notice any subtle change in sensation. That is the beginning of momentum. Make a commitment to 3 sets tomorrow. Link them to activities you already enjoy so they become automatic. Tell a friend or family member what you are doing so they can encourage you. Track how your legs feel at the end of each day for the next 2 weeks. Most people notice less swelling, fewer cramps, and a lighter feeling in their steps within 10 to 14 days. If you have already tried ankle pumps in the past, I would love to hear how they worked for you. Did you notice the difference in swelling, sleep, or energy? What time of day did you find easiest to remember them? Share your experience in the comments. Your story might be the exact encouragement someone else needs to begin. If you know someone who complains about heavy legs, cold feet, or nighttime cramps, send them this video. The simplest gifts are often the most powerful. A few minutes of ankle pumps cost nothing, require no equipment, and can be done while you do almost anything else. Remember, this is not about fighting age. It is about working with the elegant systems your body already possesses. The calf muscle pump evolved over millions of years to keep us moving. Modern life has quieted that pump, but we can reactivate it anytime we choose. You deserve to move through your days with greater comfort and confidence. You deserve warm feet at night and legs that feel ready to carry you where you want to go. Those goals are closer than they appear. They begin with one deliberate point and flex of your ankles. Start today. Stay consistent. Watch what happens. Your legs have been waiting for this conversation and they will answer. I will be reading the comments and answering questions as they come in. If you would like a printable reminder sheet with the exact protocol, the best times to do the exercise, and the progression steps, let me know below. I am happy to create resources that make this even easier to follow. Thank you for spending this time with me. Your willingness to learn how your body works is the first and most important step toward lasting change. Keep moving, keep pumping, and keep believing that small, consistent actions create big results. I will see you in the comments, and I look forward to hearing how your legs are feeling a few weeks from now. One last thought before we finish. Many of the patients who see the biggest improvements are the ones who combine ankle pumps with a gentle evening walk when they are able. The walk adds variety. The pumps protect them during the hours they must sit. Together, they create a complete strategy that fits real life instead of demanding that life rearrange itself around exercise. You do not need perfection. You only need to begin 5 minutes, 3 times a day. That is enough to move the numbers in the right direction and, more importantly, to move the quality of your days in the right direction. Take that first set right now. Feel your calves wake up. Notice your feet begin to warm. Then imagine tomorrow morning waking up without the usual ache. That future is available to you, and it starts with the simple motion of pointing and flexing your ankles. You have everything you need. Use it. Your independence, your comfort, and your joy in daily movement are worth the small effort. I am rooting for you. Your body is capable of more than you have been told. Let's prove it together, one ankle pump at a time.